The lecture elucidates the intricate process of glucose absorption in the liver, emphasizing its crucial role in providing energy to both insulin-dependent and insulin-independent tissues throughout the body. One prevalent metabolic disorder, lactase deficiency, significantly impacts the body's ability to break down lactose. This condition frequently manifests in children, leading to symptoms such as hypoglycemia and various gastrointestinal disturbances. The pathogenesis of lactase deficiency is multifaceted, involving not only glucose scarcity, but also complications such as dysbiosis, dehydration, and acid-base imbalances, all of which arise from disruptions within the intestinal environment. In terms of glucose production, the primary pathways encompass the breakdown of carbohydrates as well as the conversion of lactic acid in the liver, facilitated by the Cori cycle. This biochemical process ensures a consistent and reliable supply of glucose for the body's energy demands. Insulin serves a pivotal function in the transportation of glucose, acting as a facilitator that permits glucose to enter insulin-dependent tissues. This mechanism is fundamental for sustaining adequate energy levels within the body's systems. The hormones influencing glucose levels can be categorized into two principal groups: insulin-secretive and counterregulatory hormones. Each of these groups plays a distinct role in either decreasing or increasing blood glucose concentrations, a balance that is essential for maintaining metabolic homeostasis. Understanding the conditions of hypoglycemia and hyperglycemia is critical, as these represent two primary disturbances in blood glucose levels, each associated with unique causes and symptoms. This comprehension is vital for effective diabetes management strategies. Hypoglycemia often results from an insulin overdose, a condition frequently observed in diabetic patients undergoing insulin therapy. This state can lead to serious complications, including unconsciousness and, in severe cases, coma. Conversely, hyperglycemia is characterized by elevated blood glucose concentrations and can arise from various factors, including dietary choices. Appropriate management of nutritional intake is critical for preventing episodes of hyperglycemia. Insulin is instrumental in the metabolism of glucose, facilitating its entry into insulin-dependent tissues, thereby effectively regulating blood sugar levels within the body. In diabetes, the condition may not necessarily stem from a complete absence of insulin effects, particularly in the context of type 2 diabetes. This nuance complicates treatment strategies, necessitating a refined approach to management. The influence of insulin extends across various metabolic pathways, including those governing carbohydrate, lipid, and protein metabolism. This highlights its essential role in sustaining overall metabolic health. Furthermore, insulin stimulates lipid synthesis while simultaneously inhibiting lipolysis, a regulatory mechanism that is crucial for both energy storage and utilization within the body, which is essential for metabolic balance. An excessive production of cholesterol can precipitate atherosclerosis, thereby positioning insulin as an anti-atherosclerotic hormone through its inhibitory influence on this process. This function underscores the significance of insulin in maintaining cardiovascular health. Diabetes is categorized into two main types. Insulin-dependent diabetes arises from insufficient insulin production, whereas non-insulin-dependent diabetes is primarily due to insulin resistance. A clear understanding of these classifications is imperative for effective management strategies. Insulin deficiency leads to significant metabolic disruptions, notably in muscle, adipose, and liver tissues, culminating in hyperglycemia and a range of associated symptoms. These alterations underscore the critical role of insulin in energy metabolism. The presence of glucose in urine, termed glucosuria, results in increased urination and subsequent dehydration. This condition exemplifies the osmotic effects of glucose on renal functioning. Lactic acidosis represents a severe complication linked to diabetes and is characterized by anaerobic glycolysis, resulting in the accumulation of lactic acid, which can pose life-threatening risks. Moreover, glycosylated hemoglobin can adversely affect oxygen transport, leading to hypoxic states that complicate diabetes management and overall patient health. Clinicians must closely monitor this parameter. Increased protein catabolism, often observed in diabetes, can lead to undesirable outcomes such as weight loss and compromised wound healing, as essential proteins are utilized for immune functions. This depletion can exacerbate patient prognosis. Insulin plays a vital role in lipid metabolism. Its deficiency is associated with elevated triglyceride levels and an increased risk of atherosclerosis among diabetic patients. Ketoacidosis emerges as a significant complication of diabetes, marked by disturbances in lipid metabolism and elevated glucose levels. This condition may often be misinterpreted as hypoglycemia, which leads to critical errors in management. Dehydration and electrolyte imbalances are frequent in diabetic patients due to insulin deficiency, manifesting in symptoms such as dry skin, excessive thirst, and an increased frequency of urination. The progression of type 2 diabetes can transition from insulin resistance to insulin deficiency, which is characterized by elevated insulin production and eventual exhaustion of beta cells. This progression significantly raises the risk for severe complications. Obesity is recognized as a major risk factor for type 2 diabetes, with approximately 90% of diagnosed individuals classified as overweight. Understanding this correlation is essential for devising effective diabetes prevention strategies. The video further explores the ramifications of disruptions in energy metabolism on diabetes, highlighting how these disturbances can arise from various deficiencies, including those related to essential vitamins and minerals. Diagnostic assessments for diabetes, such as glucose tolerance tests, play a crucial role in identifying the condition. These tests evaluate the body's ability to manage glucose levels following intake, offering insights into metabolic function. Coma represents an extreme metabolic state that poses significant threats to life, characterized by severe disturbances and loss of reflexes. Recovery from such a state necessitates external medical intervention, distinguishing it from simpler fainting episodes. Angiopathy encompasses vascular complications that can result in severe health challenges, such as vision loss from retinopathy and potential limb loss due to lower extremity issues. These complications profoundly affect the quality of life for individuals with diabetes. Lastly, macroangiopathy influences large blood vessels, leading to conditions such as atherosclerosis, which can culminate in heart attacks or strokes. Understanding these risks is essential for the proactive management of diabetes.